Unemployment can have prolonged mental health challenges for young people, especially being continuously rejected by the job market and dealing with an uncertain future and trying to survive the daily struggles might also lead to anxiety, depression, low self-worth, or even suicide. And today, as we mark South Africa's Youth Day, we take a look at the holistic and psychological support that's needed to support unemployed young people who are struggling with significant mental health conditions. And we're joined virtually now by Dr Nellie Zembe, who's Head of Monitoring and Evaluation at Afrika Tikkun. Dr Zembe, thanks so much for your time. Welcome to Morning Live.
Good morning. Thank you for having me.
So this, of course, is a very serious issue for young people. But are South Africa's youth being ignored in terms of their struggles with mental illness and hopelessness?
So I wouldn't say ignored per se. I do think it's a very new area of challenges amongst the young people that we were unaware of. But now more and more, as we've started to see what it actually looks like, it's becoming more apparent that the two are connected, and we can't necessarily separate interventions that are geared to get them into employment from those that are designed to make sure that they're feeling healthy, that they are supported. So the two of those things actually go together, the social support that they need together with getting young people into jobs.
And when we look at the dangerously high levels of unemployment among the youth, how does this joblessness impact on young people's mental health?
Oh, in a lot of ways, actually. I think what we have found just from preliminary research internally in Afrika Tikkun is that young people are feeling isolated. In as much as there's 10.3 million young people out there who are looking for work, each individual is experiencing it in their own unique way with their own surroundings. And so it really feels like a personal thing that's happening to them. It feels like a personal challenge, and that isolation is what's leading to issues of suicidal ideation, depression, and anxiety, like you said earlier. And when we're looking amongst these young people who are coming to us, we want to measure what's their help-seeking behavior, because young people who are feeling like there is hope out there will seek for help. And that's where it gets really problematic, is that a lot of them don't have that help-seeking behavior. We want to promote that amongst young people to understand that it's not an individual journey. It's not just you who's experiencing this. There is help out there. There is over 280 programs that are working with youth, trying to get them into employment. And therefore, it's about being resourceful, but knowing where to find help, and that it's not a hopeless situation per se.
The reality, though, is a very different one for most of South Africa's youth, Dr. Zembe, because they, as you say, the opportunities may be there, but they have no access to them for whatever reason. And as such, their reality is a rather stark one. And that coupled with feelings of low self-esteem, of hopelessness and helplessness, you know, what can parents do when you have this young person who completed school, may have even completed an undergrad or postgrad degree, and cannot find employment? How do you support your young adults at home?
Well, I think at home it's really to just connect them to the right kind of resources, because often you find this is not just the young person's issue, right? It's also existing in the home. You're having a lot of burdens that are on the parents that sometimes they don't even have enough social capital to also show up for these young people. And so our biggest thing is to get out of that environment, to get out of a space where it's looking like you're bogged down by the challenges, and to connect to the community resources or even national and provincial resources that are being made available. To get out of the home situation is actually what we recommend, because the first thing that happens once a young person gets out is that they are now in a more positive environment. Just being amongst other young people who are sharing the exact same experience gives a sense of belonging. It gives them a sense of hope that this is actually possible. And so programs that are designed to bring young people together in a positive environment, talking about how things can be different, but more importantly, bringing in young people who have gone through the same channels and bringing them back to showcase how this is possible, regardless of what the home situation is or where they're coming from, has a profound impact on young people, because if it's always adults who are talking at young people, it always feels like, but you don't understand us. And so this is where we found that peer-to-peer, unintentional mentorship that happens when young people are in a space together is really important.
And unfortunately, that could be positive or negative, because we just did a story now from El Dorado Park where 3 young people were once again killed over the weekend. And this is an every weekend story in a township like El Dorado Park, where guns are rife, drugs are rife, and then all these sort of negative things are all around. And you say, try and remove yourself from the environment. How do you do that in a community where you are confronted with these things the minute you step out of the door? And maybe sometimes it's in the house.
Yeah. And that's just the reality of it, right? You're absolutely right, is that there's a cycle that's going around between unemployment, drug abuse, and all of the negative behavior that we don't want to actually reinforce, but that's what's happening in the environment, which is why I'm saying that there is programs in there, even in El Dorado Park. And unfortunately, young people who are resourceful know how to find it, right? How do we make it more visible? It's basically, platforms like this where we're really talking about the kinds of programs that young people can get connected to, and plugging in young people who have gone through this process. One individual, 2 individuals, they make a difference to 1 or 2 others. And yes, the problem is big, but we have to definitely support more and more those interventions that are designed to plug in something positive in these environments.
And then, of course, going through all of these problems, suicide, another mental health crisis that affects young people disproportionately so today. How does one encourage them to have better self-esteem, to have better self-worth? How do we as a society contribute to this?
Yeah. And so we have to pair the interventions together, right? We can't have interventions for mental health separate from the interventions for youth development and youth employment. They go hand in hand, because what you do on the one definitely affects the other. We are coming in and saying, in as much as we want to improve education outcomes and skills outcomes, what is happening is that there's still an individual here who still needs, whether it's nutrition, whether it's support with clothes, or if it's just counseling that they need to talk through some of the traumatic things that they've been through. And so these interventions need to coexist so that young people can access them better. What is the low-hanging fruit for them is that they need jobs, right? So if a program is designed to get them into jobs, that's where you plug in the mental health support, because it's secondary, right? We know this in terms of their own needs. The first thing that they need is they need a source of income. If you can attract them from there and then say, but what kind of individual is getting into this job? How equipped are you to get into this job? How are you showing up as an individual? And so you make social workers available, you make group counseling sessions available, so that when they're talking about their experiences as individuals, they can see that it's not an individual experience and this is where I can access help. You plug in professionals, and this is all like sprinkling into their journey of trying to get into work. Otherwise, when it's direct, we know our young people are not going to access it as much as we would like them to, because historically we just haven't been, we haven't been encouraged to access mental health support. There's a lot of stigma around, you have a mental health, something is happening with your mental health, therefore something is wrong with you. So we also need to just address that kind of stigmatization, the negative perceptions around looking for help, and getting other young people into these spaces, talking positively around, this is what I was going through, this is the help that I got, and this is the difference that it made in my life. Because like I said, it's like it has to be somebody of their own age group, somebody that they can relate to, that they're saying, okay, maybe this is possible, it's not just a me thing.
Well, Dr. Zembe, so much to talk about, but unfortunately we have to leave it there. Dr. Nellie Zembe is head of monitoring and evaluation at Afrika Tikkun, talking to us about the mental health conditions brought on by being unemployed, especially among young people who face an uncertain future.